Oh, just record.
Hi everyone, I'm Sandra. I'm a mom and my son has a substance use disorder. I'm doing this video to spread awareness and addressing a grade 11 class. I sent 2 questions to the class. One was, what comes to mind when you think of addiction? And the other question is, what do you want to know about the opioid crisis? What I learned from the answers is that 90% of the students knew what addiction was. They also know that we are in an opioid crisis. We all know it's not a secret, and I'm just glad to know that these students know what's going on. This is great. My question is, where are you getting your information? Is it from a reliable source? Wouldn't it be great if addiction was part of our education system, added to our curriculum? This is what I would like you to know. Before we begin, what is an opioid? An opioid is a drug with pain relieving properties. Some examples of an opioid: fentanyl, morphine, oxy, heroin. We are in a crisis. The crisis began in 2016. In 2016, 9,000 people died of opioid-related deaths. In 2017, there were 11 deaths a day. The numbers keep rising. The culprit of this opioid crisis that we are in is fentanyl. And fentanyl is so dangerous because not only can you not smell it, you can't taste it, and you can't see it. And it only takes a couple grains of it to kill you. More information on the crisis that we're in, you can find it on canada.ca. I'll also link the website below. Another thing I want to talk to you about is harm reduction. I mean, it's a fact. There are many people out there that are substance use users. I want you to know that there are fentanyl testing strips. These strips can test your drugs to see if there's fentanyl in it, although it will not detect any copycat drug that has the same effects as fentanyl. You could also bring your drugs to a consumption site, a supervised consumption site, and they will test your drugs for you. I also want you to know that there are naloxone kits out there. Naloxone kits reverses overdoses. It saves lives. If you are a substance user, it is so important to practice harm reduction. And another thing is not using alone. If you're using alone and you overdose, there's no bringing you back. I suggest that you have a naloxone kit with you. And if someone does overdose, the first thing you need to do is call 911. Once you've called 911, then you could administer the naloxone. And it is a nasal spray, so it's easy to administer. The beautiful thing is that our federal government has put into place the Good Samaritan Act, which means if you are using, sometimes people fear, they don't want to call 911 because they're afraid of being arrested. Well, with the Good Samaritan Act, you will not be charged. They want you to call. They want you to save a life. I also want you to know that addiction is a family disease. It does not only affect the person that is using, it affects anybody that loves them. I know that as the mom of an addict. I want you to also know that if you are affected by addiction, whether you are the user or the loved one, there are supports out there. Addiction hijacks the user's brains, the brain. The way I describe it is the addiction monster. Once you feed that addiction monster, it gets hungry and it wants more. And I know as a mom, I cannot compete with that addiction monster. The user, if they don't get their fix, they start to withdraw. And what happens when they withdraw is that they get sick. And because the sickness is so debilitating, instead of getting help, many will just go back to using. It is a horribly vicious circle. Unfortunately, what people don't understand is that addiction is actually a health issue. It is not a criminal issue. Criminal things happen only because as a user, you have to use every day so that you're not withdrawing, and that addiction monster needs to be fed. And that's when criminal activity can happen. But really, it is a health issue. If we took care of it as a health issue, we can get rid of the criminal part of it. Another thing I'd like you to know is that there is concurrent disorder. A concurrent disorder is a person that has both a mental health disorder and a substance use disorder. What I want you to know also is that it's so important for us to keep our mental health in check, because it's shown that 40% of people with a mental illness can develop addiction. Also, someone that has a substance use disorder, addiction, can develop mental health issues. And that's why we have concurrent disorder. We have both. What are we doing about this opioid crisis? On a good note, the provincial government, we now have a ministry as of October 27, 2021. They announced that we now have a mental health and addiction ministry. And they have a vision statement, and I'm going to read it verbatim. Their vision is a province where all Ontarians have access to high quality, easily accessible mental health and addiction support throughout their lifetime, where and when they need it. What rings out for me is easily accessible. As of now, it is very challenging to get help if somebody wants to go to a rehab. If you have money, if you have $30,000, sure, you can get help right away. If you don't, it's not accessible to you. You are on a waiting list. And I know people that are on waiting lists and they really want help. And it's really difficult. Waiting a week is difficult. I know someone that's been waiting 4 months already and still waiting. What else are we doing? Well, the federal government is making the naloxone kits available for free. I've picked mine up at Shoppers Drug Mart. So there's no harm in having one, especially if you're around people that may use. It is life-saving. They also put into place, like I mentioned earlier, the Good Samaritan Act. So if somebody does overdose and you call 911, no one will be charged. Another thing is that they're approving more supervised consumption sites, which is great. I want to thank your teacher for reaching out so that we can have this discussion. I think it's amazing, and I really hope that we continue to engage in these conversations. One of the reasons my son and I started our Spirit to Live YouTube channel is because of the stigma that's attached to addiction. The stigma prevents people from getting the help that they need. People feel shame. I am not ashamed to say that my son has a substance use disorder. It is a disease and it can be fatal. It is so important that we talk about it and bring attention and awareness to it. Because of the stigma, people aren't talking about it like any other disease. And you're the young generation and you can make a difference. We need to talk about it. We need more help. We need more supports. The one thing my son and I always say at the end of every video, which rings true, where there is breath, there is hope. I want to thank you all for all your comments and your questions. Feel free to leave me a message or another question. We've been doing these videos for 3 years now, and I am going to continue to advocate for those that can't advocate for themselves. Thank you so much, and remember, where there is breath, there is hope. Take care, everyone. Bye.